The next disorder we're going to look at is thrombosis, and thrombosis is defined as the formation of an intravascular mass during life from the constituents or the components of blood. So in order to understand what actually brings about or what causes thrombosis, there are three factors that form Virchow's triad, and it's very important that you understand these three factors. The first factor is endothelial injury. So this is the cells lining blood vessels, and examples of disorders would be atheroma or atherosclerosis, where you have lipids, extracellular matrix deposited in the intima. And the second factor in Virchow's triad is hypercoagulability. For example, if you have abnormalities in the clotting factors or the fibrinolytic process. And the third factor is any disruption of laminar blood flow. So the normal blood flow through the vessel should be very smooth and laminar. And if there is a structural abnormality of the vessel, for example, there's an aneurysmal dilatation, as you can see in this little drawing up here, that can give rise to turbulent blood flow. Other things that can cause turbulence would be prosthetic heart valves, so patients who've had previous cardiac surgery, and even arrhythmias such as atrial fibrillation. So any of these three factors can predispose a patient to thrombosis. So now let's look at some of the consequences or the fates of thrombosis. One of the most important events that can occur is occlusion or obstruction of the vessel, as you can see here in this little drawing. If there is a solid clot blocking up the vessel, especially if it occurs in a very vital vessel such as the coronary artery, for example in atheroma, if the plaque ruptures, you can have thrombosis, and this can lead to ischemic necrosis or infarction of the underlying organ, such as acute myocardial infarction. Another possible consequence is embolism. So again, let's look at how we define embolism. So this is defined as a detached intravascular mass that is carried by the blood within the bloodstream to a distant site. So it goes into progressively smaller vessels, and then eventually it gets lodged there. Embolism can be formed of things other than thrombosis or blood clot. So they can be solid in the sense of the thrombus, but they can also be gaseous, for example in divers bends, deep sea divers, and you can read more about this. And also you can have fat or marrow embolism, and this occurs in patients with fractures of the large bones. Sometimes the fatty bone marrow can get implanted into a vessel and then get carried off to a distant site. So what actually happens when they go off to a distant site? Of course, the tissue that is being supplied by that blood vessel at a distant site can also undergo infarction or ischemic necrosis. Other possible fates of thrombi include organization or recanalization, so you get a little lumen, a new lumen forming within the thrombosed vessel, and another one would be resolution. So what happens is that the clot or the thrombus will actually be dissolved by the process of fibrinolysis, and you have a maintenance of patency and blood flow within the vessel. The next hemodynamic disorder that we will discuss is hemorrhage. So first of all, how do we define hemorrhage? Hemorrhage is defined as the extravasation of blood into the extravascular space, and we can just roughly divide it into two arms, and one of course is traumatic and the other one would be spontaneous or non-traumatic, not due to any physical vessel injury. So for the traumatic one, I mean, it's quite obvious, you know, for example, if a vessel is transected, if it is cut, say from penetrating injury, then of course this will lead to hemorrhage. For the spontaneous cases of hemorrhage, there could be an underlying abnormal blood vessel, and again this would be seen in cases of aneurysms or aneurysmal dilatation, because the vessel wall is very weak here and is prone to rupture. And we can also have bleeding diathesis. So this is like in direct contrast to hypercoagulable states. Sometimes there's abnormalities in clotting factors as well that can predispose a patient to being more prone to bleed. So when we talk about hemorrhage, again, then we can subdivide it into acute hemorrhage as well as chronic hemorrhage. Chronic hemorrhage usually will manifest itself as anemia, the iron deficiency anemia, so patients will feel weak and they will look pale, and it occurs over a long period of time. For acute hemorrhage, often these patients, if it is in a large enough vessel and there is the volume of blood that comes out is sufficient, the patient may go into shock. So now I want to focus on shock, which is the final hemodynamic disorder that we will be discussing. Shock is defined as a state of inadequate tissue perfusion, which then leads to reversible or irreversible tissue injury and then potentially death. So if it's caught at an early enough point, the tissue injury can still be reversible. And there are some categories of shock. The first category that we're going to talk about is called hypovolemic shock. And this, of course, may be due to loss of blood, such as acute hemorrhage. For example, if a patient an aneurysm in a very large and important vessel, such as the aorta, and it ruptures, this can cause severe hemorrhage and bleeding and give rise to hypovolemic shock. Another example would be in severe burns, where the patients will lose a lot of fluid by the process of edema, exudation, because of increased vascular permeability into the interstitium. And another example will also be diarrhea. So it's not always due to direct blood loss, so you can lose fluid through the gut as well. The second category of shock is known as cardiogenic shock. And very simply, this is due to pump failure, which is, due to the heart, which is a cardiac pump that provides the energy to pump the blood through to the body and give rise to systemic tissue perfusion. The next category is called distributive shock, and this is more due to generalized vasodilation. So there is no real decrease in volume of blood, but what happens is that the vessels are all filled up with blood, and there's sort of active hyperemia within the vessels all over the body in a systemic state. And an example would be septic shock caused by bacterial infections. Some of the toxins can give rise to vasodilation, and also neurogenic shock. If there is any spinal injury, this can give rise to generalized vasodilation as well, and decrease in blood pressure, and therefore inadequate tissue perfusion.